ئێستادا ناتوانێت بەشی پێویستی نەخۆش دابین بکەن لەبەرەوە ئێستا هاوڵاتیان ئەرکێکی زۆریان لەسەرە و مەجبورن لە کەرتی تایبەت دەرمانەکان پێیان
لێرە عیلاجەکەی دەست نەکەو ناردیان لە دەرەوە 200,000 عیلاجیان بۆ هێنا ئەگەر هاوکاری بکەن بۆ عیلاجانە ئەو کاتە ئەو نەخۆشیە کاراسانی نەخۆشی وامان هەیە عیلاجەکەی زۆر ئاسایە احتیاجی لە دەروی لە ناوەی هەر چارەسەرەکەی هی واشمانەیە ناتوانێت چارەسەری خۆی بکات.
Save many lives here in our region, Kurdistan region, because really in the last 2 years, because of the financial crisis which happened in our region, and because of the influx of huge number of refugee and IDP internal displaced personnel, there was a load on our hospitals, and unfortunately our hospitals service declining a lot during the last 2 years. And thanks for your help, reached children in our region, both for host community and internally displaced person. We hope this help will continue because really life and survival of many children depend on your help, and we appreciate your help again. Thanks for you all.
You are welcome. Really, we are emergency surgical teaching hospital in Suli. We are daily receiving about 1,000 patients per day, and we have 200 admission per day. Really, in this situation in Kurdistan region, Iraq, we have a big financial and political problem which affect the medical service in all the hospitals, especially this hospital, because it is the only emergency hospital working in a standard level. In this hospital daily about 50 operations done, and about 200 minor procedures done daily with 200 admission, as I told you. Really, we have a big problem regarding the medical supplier, equipment, and even the doctor and number of the doctor and the staff. With the help of many organizations, we can run this hospital. One of the main and supportive organization is the Kurdistan, which is a big support for our hospital all the times. If we have a problem and it is not solved by us or by the government, we can ask this organization, which is always, they are welcoming us and they are supporting. Recently, with the help of Direct Relief, which is an American organization, what we receive now is those drugs which is not available even in the market, even without quality control, without any medical identity. We cannot buy from the market, which is very beneficial for our children and our patients. But thankfully, the Direct Relief, on the way of Kurdistan, they are helping us, and it is appreciated. Especially, for example, they supply EpiPen for our hospital, which is very beneficial. We distribute on the staff. Previously, most of the patient during, for example, some injections, some bites, some anaphylaxis by the drugs, there is no such a way. They should directly send the patient to the ER now. After redistribution, those special drugs, special injection, which is EpiPen, and we training them on that injection. It is very beneficial for them. I hope the Direct Relief and Manal Parezi Kurdistan, they are supporting us more openly for some of the drugs which is in difficulty. We can reach them. Even in the market, we cannot buy them because we have as I told you, we have a deficiency on those drugs, we have a deficiency on the budget, even we have a deficiency on getting those drugs. That's why we ask them if they can continue with us. It is helpful for us and for our patient and country. Thank you.
we, as Kurdistan Save the Children, would love to thank the organization of Direct Relief for the support of providing the medicine to the vulnerable children in our region. Unfortunately, due to the financial crisis, the hospitals, especially the pediatric hospitals, are in need of the medicine. In our country, health system is public and are free for everyone. For that reason, health system or health department need a lot of support, especially from the government, for providing the medicines and all the other medical equipment. Unfortunately, there are lack of different types of medicines, so we are hoping to get more medicines from Direct Relief to support children.